What are side effects of repurposed stroke medications? Imagine a medication that was originally meant for one health issue but is now being used to help stroke patients recover. While these drugs can be very helpful, they also come with potential side effects that need careful attention. Let's explore what some of these side effects are, based on current medical understanding. Many repurposed medications used right after an ischemic stroke, such as clot-busting drugs like alteplase, carry a significant risk of bleeding. This can include bruising, bleeding gums, or more serious issues like bleeding inside the brain. Because of this, close monitoring by healthcare professionals is essential during treatment to catch any signs of bleeding early and prevent severe complications. Some medications used in stroke recovery can also affect the heart and blood vessels. For example, certain drugs might increase the risk of heart attack, stroke, or even sudden cardiac death, especially in older adults or when multiple medications are taken together. Non-steroidal anti-inflammatory drugs and some blood pressure medicines are examples that can have these cardiovascular side effects. Neurological and mental health side effects are also common. Selective serotonin reuptake inhibitors, which are often used to treat depression after a stroke, can cause side effects like dizziness, sleep problems, or increased bleeding risk because they affect how platelets work. Other drugs like benzodiazepines or dopamine blockers might cause sedation or slow down motor recovery, making rehabilitation more challenging. Patients might also experience nausea, vomiting, muscle spasms, skin reactions such as rashes or swelling, or changes in blood pressure and heart rate. For instance, alteplase can sometimes trigger allergic reactions or breathing difficulties in some individuals. Because many stroke survivors are on multiple medications for other health issues, combining these drugs can increase the chance of side effects. Overlapping effects on bleeding, or the heart requiring careful management by healthcare providers to balance the benefits of treatment with potential risks. It's important to remember that each person responds differently, and what causes side effects in one person might not in another. Some studies suggest that certain medications like clonidine, prazosin, benzodiazepines, or phenytoin might interfere with stroke recovery, but it's not always clear if the drugs themselves or the conditions they treat are responsible. More research is ongoing to understand these effects better. In managing these side effects, doctors carefully choose medications, adjust doses as needed, and monitor patients closely. Patients should never stop or change medications without talking to their healthcare team, because stroke recovery is complex and highly individualized. While repurposed medications can be very helpful, being aware of potential side effects and working with healthcare providers ensures the safest and most effective recovery journey.